Jai Devendra Bhai, we can start.
All right, good. Let's start. All right, everybody. How is everybody? Today we're going to talk about yoga and meditation or mindfulness is here for ADHD and evidence from some RCTs. Okay. So again, we're going to talk more about the research side. Uh, um, Randomized controlled trials under the picture. Again, we try and pick the best studies. There are other studies that are showing benefit, not reliable, right? So there are many studies, but they will pick the ones that are pretty much the known randomized. So you know what's there, what's not there. All right. So we basically know why ADHD matters, affects attention, impulse control, hyperactivity, right? So three main things: attention, particularly as they older, it's more attention that we notice. Younger, the impulse control, and then also younger, slightly as they get older, the hyperactivity. And across lifespan. Preschoolers, school age kids with ADHD often struggle in classrooms, as we heard from uh, Naina for the last several days. And, with the peers learning many things we heard. And then adults report more disorganization, emotional reactivity, and difficulty sustaining focus at work, at home, and overall success. So we reviewed that. So why is yoga and meditation relevant? Why would it help? Well, yoga blends movement, breath, and focused attention. Generally, attention is a key part of yoga. So you can imagine that if you did get good at it, it should work. All the poses we did, I mean, that takes a lot of attention, listening to the yoga trainer, following instructions. So then mindfulness or prakshadhyan type meditation trains awareness of thoughts, feeling, and urges without reacting. So it gives you that pause before you react. So you can imagine how mindfulness or prakshadhyan would work. And this could be very easily integrated into standard care. Of course, not replacement, but can help. However, there are some limitations in these studies. They are all small studies. We mentioned before, very hard to do studies in large numbers. So they're not the level that you could say yes for sure in uh, a discerning strict scientist would say, yeah, I like it, but give me more data. The effects are pretty good and seem to be more on attention and generally how you feel. And of course, more research is needed. Okay, so let's take it further. So generally, the first study was one of the first RCTs actually was very recently, 2018. The other studies before, but they were not quite the RCTs. And they had 23 preschoolers, not a large sample size, but in children it's hard. And they had ADHD. And they had 30 minutes of group classes twice a week at school and home, and sessions um, also on non-class days. It's a 6 week randomized. So the way they sorted, some would get it, some wouldn't get it, but they would pick a random number. And then that's how they get into a study, not because they wanted to, they chose to, the parents wanted to, or the trainer wanted it. It happened by random so that we could be sure this is a fair way. Okay. And they used at that time DVDs or home videos to help. What they found is improved reaction time and fewer omission errors on attention tasks. So they would be able to react to changes on a screen quickly, and they would make less errors by missing, right? Which is so they're less distractible. And those with more severe ADHD showed the best improvement as far as the parents' good assessment was. So in general, these worked. What the heart rate variability, which is the HRV, which we've heard before, that's like a measure of your vagal nerve and how much you're improving your vagal nerve. They didn't see a change in that, right? They used a manualized yoga curriculum, just more yoga. If it was bird yoga, is what they called it, with 30-minute classes. And they basically had themes, ocean themes, because age. Then the jungle themes, space yoga, adventures, and in that they incorporated yoga. And they did a little bit of concept of breathing practices, postures, relaxation. So try to mix it, but the poses were more fun so that they would like them. And so the standing balance poses were bird dog, so that they were like a little modified from yoga, chair poses, and they had airplane pose, which balanced arms extension. And then supine ones were happy baby pose. So very much what we would do, make it a little bit more fun. And sometimes the longer sequence protocols they couldn't do because the children couldn't do them. So they would sometimes skip them. So there's some limitation in what this age was feasible for children. Okay. So once they did this in small groups, 1 to 2, with assistance, so that it'd be safe and they could do something, then they had a home DVD program 3 days a week, so that they had a lot more yoga exposure at home. Right. So as I mentioned, that that study was small. There's a next study which we will talk about was kids yoga for balance and agility. In this particular one, they're looking more for balance and agility changes because that is a problem. So they had 20 children with ADHD, again, a very small number in an education center, and they did 8 weeks, randomized, controlled. So had kids yoga and regular activities. And they had 40-minute sessions once a week, led by a therapist trained in yoga. So exposure was a little less than you'd want, but that's what they did. And they did show, even despite that just 40 minutes a week, significant improvement in their balance in the scales, and that reaction speed and agility again improved. So similar effects that we're seeing. This wasn't designed to adjust the dose of medication, so that would not be expected. So how do they do that? At 5 minutes of warm-up, jogging, jumping, stretching, relaxation. Then 20 minutes of asanas, like standing, sitting, prone, and supine, and the pranayam. They did 10 minutes of yogic games that helped balance. So they modified some of the poses into a game to improve reaction time and agility. And then at the end, at 5 minutes of focused meditation, calming, and restorative, resuscitative techniques, which we would all be familiar with. So the asanas they described generally were balance and weight shifts. They didn't quite give them terms like we would understand. And then sitting was stable, upright, seated positions. So pretty much generic description, but we can predict what they used. And the pranayams were very much the Vastrika type, which is vigorous inlet exhalation. And then they had the slow rhythmic alternate nostril, which is either Nadi Chodhan Pranayam, which can be fast or slow, and of course Anulom Vilom. So they used those as best they could. The third one is an adult one. Adults with ADHD, they had about 28 or so participants. It's an 8-week group program and this was just mindfulness. Basically, they were all in the program, but while they're waiting, they'll see what happened, and then when they got the program, so they looked at it almost like before and after. So it's a slightly different structure, but it's still randomized. And there are weekly 2.5-hour groups, and then daily home practice with meditation, informal mindfulness. So a little less yoga, more mindfulness and meditation. And they found about 30 to 40% reduction in ADHD symptom scores. And quite a number improved actually in this plot. So in the plot, you can see that the meditative mindfulness group had 60% with more than 30% reduction in symptoms. So they improved by 30% in about 2/3. Compared to control group, nothing changed, you should expect. They also improved in the executive function, which means how I can plan, organize my day, my working memory, and how I can regulate my emotion to different stimuli or different events. They also seems to like it, and so there's high attendance, and they kept coming back. So this is also what Dr. Devendra Mehta found when she in the clinics, when she offered this, they kept coming back, which means they are probably finding it helpful. So it's a very positive finding. So good data and enough to suggest it works, which makes sense. All right, any questions so far on these? Otherwise, I'll just move on and we can talk at the end also. All right, so this is the study that actually Dr. Mehta did in India, and she took all her family there and other people to help. So it's a pretty hard work project in India. And we'll talk about that, where this program was set up in for children there. So basically, in this particular study, um, uh, all the kids in a school, which was a large school of more than 1,000 students, all the children who were between 6 and 11, which is about second, fifth grade, were assessed to see which children were underperforming. And then the ones that are underperforming in math, reading, English, sitting, behavior, what the teachers kind of scaled in a school called Vanderbilt, they were identified and they were enrolled in a program, right? The first phase was 6 weeks, and then there was a second phase, which went on all the way, in fact, over 2 years in the end. So at the end, after we started 76, about 69 stayed and completed the 12 program. Again, this was not randomized, this was knowing what they had, but you'll see what happens with the study. Among the children, 14 were diagnosed with other disorders, as Dr. Mehta mentioned, which is opposite defined, so where they kind of will oppose you what happens, and other behavioral complexity, but majority were just your straightforward ADHD. Okay. These kids were kids you mentioned, we sit at the back of the class, look like duffers, they used to call them. Very much not engaged with the class. They just come to school and go home, and between just already engaged with any education activities that made sense. Right. So these are the kids that are sort of failing. And they got in because they were failing in something. Okay. So what we found is they were very keen for the intervention. The school and the principal very supportive. We had to talk to the family, had a big gathering with all the family, big kind of meeting. We've offered food, the families came to talk about what we're going to do. So there's no fear. And our goal was to a multidisciplinary team where we had the pediatricians, teachers, and trained volunteers to help. These volunteers actually train in yoga in the USA to go and train there. And then we had physicians also. And the way we structured it is to have sessions for 25 minutes of yoga and meditation, and followed by about 30 minutes of play therapy, and it's a session to get feedback. This was modeled on certain therapy approaches in the USA, except that instead of yoga, they'll do physical therapy. And yoga seemed to make sense in India. So it's very much modeled on something that works, except modified for India. And then we looked at all the markers that we heard about. The key part of this study was that knowing teachers were very hard to find in India in the sense of shortages. We plan to train high schoolers, or older kids who were smart and comfortable doing a project. And we recruited them so that they could help the younger kids in the same school. And then, we give them some volunteer bonus awards, and maybe monthly we give them some clothing, something that would find valuable to reward them for their volunteerism. And so these volunteers tended to be, as I mentioned, slightly more girls than boys, but they are all very, very keen to help. And the recognition of volunteers is very, very important. And we monitor the children in terms of the scores and the teachers' scores and the parents' scores. Now, the problem with this kind of project is since everybody knows what we're doing, there's a lot of enthusiasm. So sometimes just the enthusiasm may improve. Um, and you can see why if we had randomized it, we would have seen for real what happened. But in real world, you can't go to a school like this, offer help, and not give it to half the children. It just doesn't work. So while you do want to do science, proper science, you don't want to hurt the people either or the feelings. So we decided that we would just do it to everybody and collect the data. All right. Difficult to half the kid, we're not going to help you because, probably not going to go back. Right. The questions done, the scores were done. We did 6 weeks and Dr. Mehta and the kids who helped us stayed there through 40 degrees temperature heat. It was extremely hot for 6 weeks. And in a hotel, but the schools didn't have AC, so it was a real hard work. This was a particularly hard project to do. And then 6 months, people flew in there to check how they did at 12 months and at 24 months. So we had follow up how they did. Okay. So the main things were, there's a classroom. This is how they're taught. The main thing was poses, and then 8 areas, and also, of course, how the parents felt the kids were doing. After this, we went to home visits to see what would happen to these children and how they behave at home. And many times you'll see that fractured at home. Their toothbrush was totally eroded, but their sister or brother is completely fine. So these kids are very impulsive at home. You can see in the household also how they were different to the other brothers and sisters. So it wasn't the parents' fault, something that children had, because other kids were fine in the same household. And this child would have specific issues that some had fallen off from the floor when nobody else had and had a fracture. So you could tell that this is not parental thing. This is specifically the disorder they had. This is a teacher that we had trained. So the results were very impressive, right? So about 73%, that's a little over 2/3, showed improvement in their scores. They showed improvement in yoga position. They improved their breathing. So the Mahaprandwani we used, and that Mahaprandwani increased in time, which gives a sense that they were focusing, attentive, and it was helping them. So we measured that timing. We clocked 3 times, the longest they did, and measured all that record. And also their maintenance scores improved in terms of how well they sat without movement. So we scored all of that, and you can see they can be taught. Even the kids could be taught, would learn, and be able to apply it. And actually, they were enjoying it. And the older children helping made it good for the older children. And I think in the same class, in the same school, somebody older who's looking after you, you as a child feel esteem, right? That somebody else is finding you valuable. So the self-esteem also went up, which we noted throughout. So let's say, and then we followed for a year later. And we found that the improvement from baseline was significant. In fact, the improvement we saw from 0 to 6 weeks in terms of behavior, only about 27% had still ADHD symptoms. Really, that was within close to normal range. That was sustained, so it didn't go away. It was sustained. They stayed well. And the teachers also had a improvement that they scored. So the scores are pretty generic across board. And when we went a year later, the improvement also sustained. So generally, it's an effective measure and it's sustained. We had a lot of different stories on the improvement. The parent teachers were in the same boat. Many of the disorders were also improving just because of care that they had. And very interesting story. Sometimes we had a teacher come and tell us that this one student back in the class hadn't talked to the teacher for 2 years. And one day came after this course to say, "Where's my homework?" And the teacher was like shocked because this kid there did not seem to attend and wasn't actually interested. So their performance went up. So what we talk about is not that their ADHD get better, their actual performance in their math, English, uh, um, finishing a work actually moved up in the scale to where other children who are normal was. So it was a dramatic improvement, again, without medications. Um, right. So, and then as you mentioned, the poses got better. And one of the most important things is that 39% of who had behavioral scores, on top of ADHD showed improvement. So it helped even the ones that had some behavioral issues in addition to ADHD. So it's a pretty dramatic program and worked exceptionally well. All right. And then we looked at the older children, and as I said, we continue to look at their proficiency even later on, a year later, and they still were keeping the Mahapraran long. And that told us they were keeping it, because if you stop doing it, your breath will shorten. Because the breath stayed long, we know they were doing it because they told us they were doing, but this is evidence they were doing it. So we could see that they're actually doing very well. And ultimately, we had a 50% showed improvement of academics that was substantial. Okay, so it's a good study, and it shows the power of combining. Now, we, of course, combined pranayam, pratyahara, basically with yoga, and there was play therapy. So there are other factors there, the peer factor, where the other older schoolmate is playing with them in these games. The games we used were games that are good for attention, like Yahtzee, things that you could imagine that we took over there. So it's a wonderful project that I think worked well. So that's it. That's the whole data point on ADHD. So quite a few of the papers are ours. I didn't want to refer to them, but at least 2 papers were our work actually, and it's an area that I think we can help children a lot. Good. Any questions?
I had a quick question. Was there it? I know you said that for this study there wasn't really a control study, so like all the kids could be had the opportunity to participate if it applied. Um, for just kind of comparison down the line, do you think there's an opportunity maybe? And I didn't catch this how long ago this study was done, but maybe in like X number of years to go back and kind of interview that population again and see longitudinally if there were any effects, if it was sustained, if they were able to continue it, if there was a difference that it had in their quality of life or such, and then comparing it to maybe like I know age you can't a factor for age, but other kids who maybe weren't in school then or weren't part of this process at that point.
Yeah, I think it's a really good thing. I think we should go back and do that. We spent time going to other sites just to expand it. So we've been busy, but we didn't go back there. We did a program in Ladin, in Rajasthan, actually Ladin. Actually, we did one in Ladin.
Okay.
We did one in Gujarat, 2 in Gujarat actually. Palitana, we did one in Rajkot, and then we did one in South America. Uh, we did one through a group in Greece.
Wow.
So we've kind of did that rather than go back. But you're absolutely right. I think it'd be good to go back. I think we have enough to do a proper RCT. It just the problem with these conditions, which I mentioned before, is that funding is hard because nobody's going to make money out of it. So we have to kind of rope up people to do it. But it's very doable. It's important to do. And unless we get the RCT, people won't make, if you like, education won't make the next strategic, if you like, allow that to occur everywhere. Because the people own education are policymakers, and they need data to make a change. Otherwise, they're not going to make a change,
It's
right?
not qualifiable data that's like statistically or clinically significant if we can't compare data, like get p values from an RCT, basically.
Yeah. We went to the governor, I think, and the education minister of UP. We actually met him because the data was so good. And it was very interesting. His wife was a teacher, and she loved it because she had these students in a class, and she told them we have to do this. And then he comes on and says, "Look, I would love to do this, but I have a tough time trying to get the kids to come to school in the first place. So where do I put my effort?" I said, "You're right. First do that. Then we need to come back together." So reality is, well, how are you going to make it work? But on the flip side is that these children should be performing adults now. They will not be defunct. They won't break their families or break the house or cost them, have crashes or be drug addicts or, so society, this is the way to go. Even if they don't, I agree with him, this getting kids to school is very important. This may be more important. Kids going to school are flunking, right? That we should fix. So, that's a debate. But the policymakers have this mindset, which is hard to fix. So you're right, without RCTs, it's very hard to convince them. But good, yeah.
Thank you.
The policies are very similar. We used there, so I don't think there's much more. We're going to go to the policies tomorrow. The ones we used, so we'll be taught those by RMSG. So I don't want to go over in detail because we're going to go over them tomorrow. But you could almost create them yourselves with the knowledge you have. You could probably create them yourself now that you know what does what. So we use a similar pose as you can imagine in breathing. We didn't do Bhastrika so much because it's hard to train it. Sometimes at the time we had that we could have, but we did the other things and we added other ones. And so Bhastrika, one of the studies didn't catch us surprised. I'm fairly sure it'll work better and heavy the way it works because you have a lot of energy. So it would be probably good to redo it with some other additives that we understand now. And maybe that's a good way to do it. But it's a very helpful, and as Dr. Mehta will tell you, when you do it and the parents and children, like you did in a clinic actually here in Orlando, the kids enjoyed it. And typically what happens is if a kid with ADHD enjoys something, focus actually is nice. They actually get something out of it they normally can't do. So it was quite remarkable to see how much they enjoyed that. So it's very unusual where you do something that actually is enjoyable for them as opposed to pushing them or making them do this because they don't want to. So it's a wonderful way to approach this. So and along the way, many family members and ADHDs and with advice, we incorporate these in their protocols. We've seen some take up on this and assistance and help, and maybe less weight on medications and less need for medications. So that's the goal. So it's a wonderful journey. It's a long journey. We have to write a big book on it one day, but it's a good journey.
Another thing that might help if a study was done like this in the future, Dr. Devendra, is if the siblings were more normal, could be involved, they doing the same program side by side, motivating, the child with the symptoms or ADHD, they might be more take into the program, and of course the parents would be interested because they see a direct benefit for their child, so they will be all along. But even the siblings, if they're involved, could push them along.
I think that's a great idea. I think accidentally, I think one or two of the volunteers' younger sibling had ADHD. They volunteered, so it happened actually. And you can see the power of that. You absolutely could, because what he did is give the sibling tools to help the little one, right? So it's not just sibling, but now I'm helping my own brother or sister, and I'm equipped to help. And I think that's a dual gain, right? Dual gain. So you're right. I think we did see that. I think that's a really good idea, and I don't see why, because mostly families are 2 or 3. So I think that would be doable. That's a really good suggestion. We could change it to just not peer or sibling mediated. We call this a peer, which means the peers are helping them,
Right.
but peer or sibling mediated. I think parents probably not a good idea, just general nature of what this is. They're more judgmental, but siblings would be great because they'd be more tolerant.
And there is less rivalry or, I guess, I don't know, maybe peers are as good as siblings.
Yeah, no, I think that's a really good idea. We should do that actually. Yeah, good suggestion. And that would be more powerful to do it with them all the time, or just more often in the week. So in the program we do here for IBS pain, like we maybe talked about with Dr. Vijay Mehta, we encourage the parent or sibling to come. And some will come and do that for the same reason. We do encourage that, and some do come, and it does help. But it's optional, and sometimes they don't. But as a study, we could do it properly. I think it's a really good idea. Good idea.
And they are more likely to continue it in their family, even after the program is over.
Yeah, and then also, when you do research and you hold sibling into it, you make sure they benefit themselves, and this helps. This helps you anyway, right? So this is one you could, because even the sibling themselves will benefit just from the yoga itself. Forget the benefit to the sibling; they'll also benefit. And so when you do that, yes. So then I think it will be. I don't think RB would not like it. They would appreciate that, as opposed to saying, why are we using that? So I think this would work. I don't think so. We have to go through IRBs, and sometimes they'll have pops that we don't think of. But this one, I can't imagine there was a problem, because the child who's helping will benefit. We know that.
Right.
So it would not be, they have to make sure everybody benefits in the circle that's involved. But this one, I think we'll go through. I think it would. It's easy to do it. There's always somebody at home.
Yeah.
Maybe my next study, I'll do that. That's a really good idea, actually. Yeah. Perfect.
Thank you, Dr. Devendra,
Mr. Vijay.
for the studies which you have discussed in context of the problem of ADHD and how yogis can work. And you have also shown the study which has been done in Delhi by Dr. Naina. So that also supports that how yoga can help. We have yesterday I talked that we have also done some studies on the school children in Delhi and also in Lucknow. We have also found very positive results of that study. We have selected very naughty children from the school. From 2000 students, we have sorted out 300 only, which were very naughty, and have done some experiments on them. So yes, for ADHD, yoga is the best medicine, or you can say remedy, which can control such hyperactivity or impulsivity of the children and also of the adults. Okay, so now it is time for meditation.
Yes.
So Rakesh will give a session, no?
Right.
Yes, you can start.
Okay. So today we will practice the meditation on the internal trip, Antaryatra. So since we will be sitting still for 30 to 40 minutes or 45 minutes, let's take a quick stretch in our body. So we'll do Tadasana 3 times. Okay. Ready, everyone? Okay, let's lock our fingers and stretch upwards, standing on our toes, breathing in, and breathing out, hands down. Second time, breathing in, let's take our hands up and stretch. And down. And one more time. Okay, let's lock our fingers, breathing in, stretching upwards, and breathing out, hands down. Okay. Okay. Next, we will choose a posture. We are all sitting in a sitting posture. Let's choose, first of all, let's keep our spine, neck, and head straight in one straight line. And choose position of our hands, whether Gyan Mudra or Vitrag Mudra, whatever feels comfortable. This is a full meditation session today. And then gently close our eyes. We'll recite the Om mantra 9 times. Relax. Breathe normally. Now we will recite the aphorism of meditation. I am practicing Preksha meditation for the purification of my psyche. I am practicing Preksha meditation for the purification of my psyche. I am practicing Preksha meditation for the purification of my psyche. The goal of the meditation is to see yourself through yourself. The first step of meditation is relaxation. It's a necessary step for any meditation, Preksha meditation, to relax our body to be able to practice the meditation. Kayotsurg is relaxation with full awareness. Let's relax our body. We will visit each and every part of our body one by one and suggest it to relax. Let's focus our attention on the big toe of the right foot. Spread your attention on the big toe and suggest it to relax. Now let's move our attention to the other toes of the right foot and suggest them to relax. Moving to the sole of the foot, the upper part of the foot, the heel, ankle, calf muscles, the knee, thigh muscles, and the hip joint. Suggest all these muscles to relax. And now we will move our attention to the left leg. Again, starting with the big toe. Feel the vibrations around the big toe and suggest it to relax. Similarly, suggest the other toes of the left foot to relax. Bring your attention to the sole of the foot and the upper part of the foot. The heel, ankle, calf muscles, the knee, thigh muscles, and the hip joint. Suggest all of these muscles to relax. Feel that both legs are now fully relaxed. Now we will move our attention to the middle part of the body, focusing on the lower abdomen. The stomach area, all the muscles around the stomach, and all the organs inside the lower abdomen, the large intestine, small intestine, kidneys, liver, spleen, the stomach, and the diaphragm. Suggest all these muscles and organs to relax. Moving to the chest area, the chest muscles, organs inside the chest, lungs, our heart. Let's suggest all the muscles and organs to relax. Now bring our attention to the right hand. Focus on the thumb of the right hand and suggest it to relax. Suggest the other fingers to relax. The palm area, the wrist, lower arm muscles, elbow, upper arm muscles, and the shoulder. Suggest all these muscles to relax. Now moving to the left hand, again starting with the thumb and the other fingers. Suggest them to relax. The palm of the hand, the wrist, lower arm muscles, elbow, upper arm muscles, and the shoulder. Suggest all the muscles to relax. Suggest all the back muscles to relax. And now moving on to the neck area and the head. All the muscles around the neck. Suggest them to relax. The vocal cord, the muscles, all the facial muscles, the chin, the cheeks, and the forehead. The back of the ears. Suggest all the muscles to relax. There's no tension, no stress anywhere. Feel that the whole body is now fully relaxed. No movement. We will maintain this posture for the rest of the meditation. Now we'll move into the practice of Antaryatra. In Antaryatra, we will focus at the bottom of our spine, the Shakti Kendra. And slowly move our attention upwards from the Shakti Kendra along the spinal cord to the top of the head, which is the Gyan Kendra. And then slowly back down to the Shakti Kendra, again traveling along the spine. This is helpful in removing any distortions in our thought about the negative emotions of fear and cruelty, which are associated with the lower chakras or kendras. Again, let's take our attention from the Shakti Kendra upwards towards the Gyan Kendra, traveling along the spinal cord and slowly moving down back to the Shakti Kendra. We will repeat this process for a few minutes silently. Now we will attach this internal trip from the Shakti Kendra to the Gyan Kendra and back to Shakti Kendra with our breath. While exhaling, take a full breath. Bring your attention to the Shakti Kendra. While exhaling, let's move our concentration upwards towards the Gyan Kendra, synchronizing it with our breath. And as we reach the top, let's inhale and move our attention down towards the Shakti Kendra. Again, synchronizing it with our breath. Exhale, moving your concentration upwards. And moving it down as you inhale. Imagine drawing water from a well with each cycle of the breath. Keep your breath slow and long. You continue for 1 more minute. Feel the vibrations, the Jnana Kendra with each breath. Now we'll conclude our meditation with the recitation of Om Mantra 2 times. Take a full breath. Rub your palms gently. Place them over your eyes. Blink a few times to absorb the energy. And slowly remove your hands and open your eyes. This concludes today's meditation.
Hopefully the meditation was good to all of you. How was the meditation?
I could not able to concentrate.
What Narendra was saying?
I was not able to concentrate. It was like itching the body.
Okay. So your mind was not concentrated.
Yes, that's correct.
Okay. So just you have to do more and more body perception.
Okay.
Okay.
Yeah.
Yes.
It was very good, very clear instructions. Extremely clear instructions. Kavit sir was good too. Thank you so much.
Thank you.
Now this is the time to
Thank
give
you,
some
Rafa.
comments or
Yes,
any
yes, yes, yes.
positive remarks
Yeah, any feedback
on
I would
session given by anyone. Yes.
Samniji, one question for the internal trip.
Yes.
Is it okay to imagine that we are Moving the energy from our Shakti Kendra to Gyan Kendra.
Yes, that is the main purpose.
Mhm.
Yes.
So when
You have to see the flow, the energy flowing towards the top of the head and getting stored there.
Okay, okay.
Yeah.
And when we come down, is it okay to come quickly, like, or
Yeah, you can come
Okay.
quickly because at that time your mind is empty without any flow of energy. You are just coming to give the lift, the energy, from below to up.
So I imagine like green or bright light at my Shakti Kendra, and then I try to move that light up to the Gyan Kendra, and then come back quickly, like.
Yeah, so that can be done.
Okay.
There is no harm in it. Just we have to give the lift to the energy which is flowing in the below part.
Okay, okay,
And that's why we are more extrovert.
okay.
So if you want to become introvert and enter into the spiritual domain, then we have to give the flow of energy upward. We have to make that flow of energy upward, and that will help us to become more and more spiritual.
Okay. Thank you.
Both the energies, the consciousness is also working in the part around the navel and the below, and our energy, vital energy, is also flowing because of that in the below part. Okay, so both should be uplifted.
Okay, okay.
You will see someone has practiced this Antaryatra at least for 4 hours. 4 hours.
Wow.
And she saw the light like the tube light in the black backbone.
Wow. The
Yes.
entire backbone is lit.
Yeah. The entire backbone has become like the tube light, full of light. She couldn't come even after 4 hours.
It's addicting.
Yes.
Okay, that's a really long time to stay in meditation. Must have been amazing.
Once you get into it, you will not come out of it.
Don't want to come out of
That's
it.
why siddhas are not coming out from liberation. They are not coming down because once you are into that domain, you would not like to come down.
Right. No, it was
Oh,
very
very
good, very good meditation, Rakesh Bhai. It was excellent. The relaxation was really good. And I actually didn't one thing I wanted to ask Somniji was when we're doing this Antaryatra and you're combining it with the breath, the focus seems to go away from moving the energy to the breath. And so I was having that problem because then I start imagining when I'm breathing in, my stomach is going out. And when I'm breathing out, I'm taking my stomach in. And so
why you are doing all these things even after 6 months?
Well, no, it's just, I was just saying that when you're trying to move the energy and you're using your breath, then I feel that your focus goes away from the energy. But does it matter what you're doing with your breath? Because if I don't focus on my breath, then I can imagine the light. Well, I don't imagine the light, but if I imagine my energy at the bottom.
I always say that don't worry about the breathing. Just focus on one thing, which is the main concern of that particular practice.
Right.
And the purpose is to upward motion of the energy on consciousness.
Right.
The consciousness which is going below or flow working in the below area, and the vital energy which is also flowing due to our consciousness in that particular part. So you give the upward motion to these energies. And that is the main purpose. You cannot focus on many things in meditation, and that is not the real meditation actually. When you are focused on one thing, then only it is meditation. When you are focusing on many things, it is not meditation at all. It is concentration.
Right.
Oh, yeah, that makes sense.
That's very true.
Meditation means to go into depth of one and one thing, which is your main concern.
Right. Every time I go up into the head, I can see white light. And then if I come, I don't feel the energy moving up the back of the spine or anything, but I can feel that if I sort of going up and down the spine, at the top, I feel the white light and I see the white light, and then I go down and then I go back up again. I see the white light. That's really practicing what I practice.
It is good sign, good sign. So don't, you have to continue with that.
Yeah. And then when I put the breath into it,
Gradually, when you will give good time to the practice, then you can see the in the entire passage.
inside the whole
time
vibration,
flowing
right?
towards. Okay?
Amazing.
Yes. Our mind should be fully concentrated on that. Fully.
Yes, yes.
There should be nothing in the mind except that one which we are practicing.
Right, right. Thank you so much.
That is meditation. Meditation is concentration on one thing for a longer period without any distraction.
Correct. So the breath is just there to help you get there.
Yes.
Yeah,
Yes.
that's what I
Because
thought.
our mind is so fickle, we don't concentrate on one thing for a while even. So we are trying to anchoring your mind somewhere.
Yes, yes. So when you're getting distracted with the mind, bring it back with the breath. But when you're there, just stay there and continue to do the journey up and down.
Yes.
It provides the
Just
rhythm.
trying to engage your mind in the practice. So somehow we are giving some hooks so that your mind can be anchored.
Yeah, and it provides a rhythm to the practice.
Yes. Otherwise, one thing is enough. Just a perception. Even you need not to take long and deep breath if you are really entering into meditation.
Correct. So I feel that better. That you forget.
These are only means to enter into the thoughtless state and to go inside.
Right.
They are supporting you to concentrate your mind, to keep your mind concentrated, without going into any kind of distractions.
Yes. Because I think when you do, you forget about your breath. You're not even thinking about the breathing. That's just happening.
No, yes, it is happening. So
You're not,
that
that's
state is real estate. That state is real estate.
Mm.
When something is happening, you are not doing anything. Okay?
Very good.
That's why the God, the divine power is told to be non-doer. He doesn't do, it happens only.
That's correct.
Okay? So they don't say that I'm doing anything. They say that
Oh,
they're just there.
yes.
just a conversation. Yeah. Going to concentrate, change to understand concentration and meditation. I think every time you sit, it becomes more clear the difference and makes sense.
Yes. In such a long period, we are getting all the secrets. Can you? And if somebody comes just once in a day in meditation, how he can or she can learn many more things,
No,
all the secrets.
I agree. Yeah.
Unless you practice, you cannot understand the secrets even. Since you are practicing from last 6 months, that's why you are able to understand what I'm saying.
Totally. Yeah. Otherwise, if you say beginning, it'll get you more confused. You're correct.
Yes. Until you practice, you cannot know the nuance.
The nuances, correct.
Nuances, yes. So thank you very much. Tomorrow, who will give the session? Surreal. Day after tomorrow, you have to be ready.
Sure, Vandami, I will.
Whatever topic you have taken, might be your topic is pranayam or mudras. Pranayam.
Pranayam. My topic is pranayam.
Okay, so you have to give all the pranayams.
Day after tomorrow. Oh, Saturday. Yeah, I will.
So I am taking the exams now, the practical exams. The two have done excellent job, Anita and Rakesh Bhai. Now the next one we have to see. Thank you.
Vandamina Mansami Samiji.
Vandamina
Vandamina
Samiji.
Samiji.
Arham.
Mandami Namasami Samniji, Kutagisi.
Arham.
Thank you, Devendra ji. Nice presentation.
Yeah, it's all about Naina.